Hello, my name is Jonna Carla Dunlap. Today I will be presenting on panic disorder. So, what is a panic disorder? A panic disorder is a common and incapacitating mental disorder characterized by the reoccurrence of spontaneous panic attacks, which I will go more in detail on the next slide. But a panic disorder involves a persistent concern about having additional attacks, worrying about the implications of the attack or the consequences that come along with it, and significant changes in the behavior related to the attacks. So, what is a panic attack? Let's dive into what the panic attack or what a panic attack involves. Panic attack is typically characterized as a discrete period of intense fear or discomfort in which several symptoms such as palpitations, pounding of the heart, sweating, trembling or shaking, having sensation of or feelings of shortness of breath or feeling like you're being smothered. There's also feeling like you're choking, having chest pains, or just overall discomfort. Some people experience nausea or abdominal distress, dizziness, unsteadiness, feeling lightheaded or fainting. There's also people that experience sterilization or depersonalization. Some people experience fear of losing control or feeling like they're just going crazy or even feeling like they're about to die or dying. There's also a sensation called paresthesis, which is a feeling of numbness or tingling or burning, usually within the hands or other extremities like your hands and your feet and toes. And also, some people experience chills or hot flashes. In order to meet criteria for a panic attack, an individual must have four or more of the symptoms I just discussed, and substance abuse and a general medical condition must be ruled out. We want to make sure that the individual is not having these symptoms because of a substance abuse disorder or a medical disorder that a medical doctor can address. And finally, panic attacks usually are very significant in causing impairments on the individual's daily functioning or just overall global functioning. So let's talk about the role of the sympathetic and parasympathetic nervous system in panic disorder. Panic disorder is often associated with the autonomic nervous system pattern, which is divided into the sympathetic nervous system or the activation and the parasympathetic nervous system, which is the withdrawal. The parasympathetic system spares central nervous system energy, while the sympathetic nervous system makes extra energy available and consumes it. The sympathetic nervous system then prepares our body for any emergency, and it always functions when our conscious or even our unconscious mind notices a need for defense or to provide an energy or energies. Some research have suggested that the pathogenesis of panic disorder might be the imbalance between the sympathetic and the parasympathetic tone, whereas the imbalance could be manifested by the activation of either the sympathetic or the parasympathetic nervous system. Now, moving on to what is the role of neurotransmitters and hormones in panic. In individuals with panic disorder, studies have found that there is evidence of decreased central aminobutyric acid activity or GABA activity, as well as marked increase in autonomic and respiratory responses. The dorsomedial prefrontal hypothalamus is enriched in neuron containing orexin, ORX, or also known as hypocretin. This has a crucial role in arousal, vigilance, and other central autonomic mobilization, all of which are key components of panic. A study done by Johnson and colleagues in 2009 found that human subjects with panic anxiety have elevated levels of ORX in the cerebral spinal fluid compared to subjects without panic anxiety. They concluded that the results suggested that the ORX system may be involved in the pathophysiology of panic anxiety. Now let's move on to fight, flight, and freeze responses. The fight flight response is an active defense strategy that can be very energetically costly, as both fleeing and fighting involve increasing activity levels. In contrast, the freeze hide response is a passive defense strategy and relies on decreasing activity and remaining immobile. A fight is a combative rejection, a flight is a retreat from contact, and a frozen reaction is a depowered and disabling reaction to the situation that the individual faces. Now let's discuss some of the potential causes of panic disorder. Although its underlying etiology is not well understood, many studies have consistently shown that genetic factors explain about half of the variance. It is likely that most cases of panic disorder have a complex genetic basis. Data suggest, however, that genetic makeup underlying panic disorder is heterogeneous and differs between cases. For example, the degree of genetic complexity and the pattern of genes involved might differ in familiar versus non-familial cases, in early versus late onset cases, or when different comorbid conditions, gender, and potential intermediate or subphenotypes are considered. For example, females are 5.1% more likely to develop panic disorders compared to males are only 1.9% of experiencing panic disorders. Now let's look at other potential causes of panic disorders. Some studies have found that family culture, events, and sociocultural background play significant factors in the potential causes of panic disorder. A study by Shim and colleagues in 2016 studied panic disorder by delving into family relations and sociocultural background in Korea, and they concluded that family characteristics played a significant role in the client's experience in panic disorder. Let's look more closely at Shim and colleagues' research on some of the potential causes of panic disorder. So they used a single case study based on counseling content from family members, which involved a client who was Korean, 34 years old, who was having symptoms of palpitations, chronic anxiety, panic attacks. And she was married to her husband, who was American and who was also 34 years old. And also the client's parents, who were both Korean. The mother was 63 and the father was 64 years old. Some of the factors that influenced the client's anxiety and panic attacks, as assessed by the researcher, was some specific family characteristics that the family had. For example, the mother's toughness and perfectionism, the father's sensitiveness and immaturity, and parental conflicts that the client's parents had, that the client witnessed growing up as a child and throughout adulthood. And another important factor that the researchers found was certain cultural or societal factors, such as the Korean society and cultural beliefs. For example, in Korean society, many still prefer sons over their daughters. For example, in the client's case, the client's mother favored the client's brother. Also, in Korean society, they place a high value on a child's education, and specifically for the client, her mother favored her brother for being smarter because the brother went to a prestigious college. So all of this, the researchers concluded that the client had developed a rage over her mother's discrimination over her and and the mother's preference over the brother versus the client, which turned into what Koreans called hwa byung, which is basically translating into an anger disorder or fire disease in Korean. In addition to that, the client was also experiencing a lot of stress because of her intermarriage or intercultural marriage. Again, she was of Korean background and her husband was of American background. So there may have been potential individualism versus collectivism concepts that were playing a factor that strained or caused some stress in the marriage and in the client that may have led into some of the factors of her developing panic disorder or panic attacks. And the researchers of the study concluded that family factors and cultural factors may influence panic disorder. And panic disorder is influenced by environmental factors as well as biological and cognitive factors in the development of panic disorder. Now let's look at some of the comorbidities of panic disorder. Study done by Chen and Lin in 2011 studied the risk of psychiatric and physical comorbidities associated with panic disorder in a nationwide population-based study done in Taiwan. They looked at 3,672 patients with at least 3 consensus diagnoses of panic disorder. And they concluded that panic disorder is associated with an array of psychiatric and physical illnesses. Let's look closely more into the study done in Taiwan regarding the comorbidities of panic disorder. Regarding psychiatric comorbidities, patients with panic disorder showed significant increased risk of psychiatric comorbidities such as major depressive disorder, generalized anxiety disorder, obsessive compulsive disorder, and substance abuse. Specifically, major depressive disorder had odds ratio of 23.45 based on their study. Bipolar disorder had 15.54 of odds ratio, while schizophrenia had 2.14 odds ratio that they found in the study. Now let's talk about some of the physical comorbidities. Some of the physical comorbidities that the study done in Taiwan found that panic disorder often had comorbidities of cardiac dysrhythmia, which is an abnormal or irregular heartbeat, coronary heart disease, myocardial infarctions, or otherwise known as a heart attack, irritable bowel syndrome, peptic ulcers, cerebrovascular diseases, which are conditions that affect the blood flowing to your brain, hypertension, asthma, neoplasm, which is a tumor or it's an abnormal growth or mass of tissue that forms when cells grow and divide more than they should, or they don't die when they're supposed to. And neoplasm may be benign, which is not cancerous, or it could be malignant, which is cancer. They've also found asthma, renal disease, and diabetes as some of the physical comorbidities of panic disorder. Fortunately, panic disorder can be treated with evidence-based treatment. One treatment is drug treatment. And drug treatment usually involves the newer family of medications called selective serotonin reuptake inhibitors, or SSRIs, which work by prolonging the effects of serotonin, which is a natural brain chemical. They're used for several other conditions and include Zoloft, Paxil, Prozac, Celexa, and Surzone. And SSRIs often have fewer side effects than the older generations of medications. And also, in addition to SSRIs, some doctors may prescribe tranquilizers like Valium, Xanax, and Klonopin. Other evidence based practice for panic disorder is CBT, or cognitive behavioral therapy, which teaches individuals to view panic attacks differently. They help patients manage anxiety provoking situations. They learn to identify cognitive distortions like catastrophizing, and they teach patients to cope with anxiety, such as avoiding shallow breaths, and they may teach the client how to do a more positive way of doing deep breaths or deep breathing from their diaphragm. And just overall being able to identify the behaviors, the thoughts, and the feelings that they have associated with panic disorder, and learning to manage and cope with those thoughts. And lastly, let's look at some of the treatment differences that may be useful in providing treatment to different populations or cultures. Let's look at the example done by Shim and her colleagues, and from the Korean family example, they looked at the importance of looking at cultural values, such as the importance of education and male child preference in some cultures, and other cultural factors, such as looking at the different concepts of collectivism and individualism, and how that may be a factor in some individuals developing panic disorders, and just overall considering different individual characteristics like parental strictness, parental conflicts or marital conflicts within the family, and also considering family as an option, family treatment, family therapy as part of the treatment plan, and looking at individualized factors of each family and looking at the development of panic disorders. And that concludes my presentation on panic disorders. Thank you for your attention today. Thank you.